So I want to go ahead and welcome those that have just joined us from the waiting room. I am the Prior Lake Rotarian president, and we welcome you to our meeting. We just got done with a few things that were our normal part of the meeting, and we're going to go ahead and get started. So I am going to do our Rotarian of the day. It's actually one of the things that we kept for our meeting for this portion. So I'm going to go ahead and introduce Doug McCollum. I believe is going to do our questions, and our Rotarian of the day today is Joni Lombard.
Good morning, everybody.
Over to you, Doug.
Good morning. Can everybody hear me? So if you're not part of our regular weekly meetings, we do Rotarian of the Day, an opportunity to get to know each other a little bit better and give everybody an opportunity to do a little public speaking, which is always good practice. So good morning, Joni.
Good morning.
So first question, what opportunities has Rotary opened for you?
Well, I think first would be travel to places that I probably wouldn't have gone. I was able to go to Haiti 3 times and Nicaragua and Uganda. And with that came friendship with people I traveled with. Oh, also we did a Cuba friendship trip. And just getting to know a Rotarian better is a good thing. And then just being part of a group that gets things done to benefit others. So that's, and there's more, but that's good enough.
What has been your Rotary moment to date?
I went to Haiti in 2007, and I was visiting a church, and a little girl was sitting on this woman's lap, and she stood up and walked across the aisle of the church, and another woman picked her up and just put her in her lap. And I realized Haiti is a very poor country, but it's rich in community, and there's really no replacement for that.
I would agree. What was your first job, and how does it compare with your present job?
My first job was as a lifeguard at the YWCA. And as a marriage and family therapist, I'm still helping people keep their heads above water. So.
Very good. And what would you tell a prospective Rotarian their greatest opportunity will be as a member of the Prior Lake Rotary?
I guess I'd say the people. That's what keeps me coming back. I mean, there's so many opportunities to do things together that make a difference, and I think that's why we're all here. So.
Great. Thank you, Joni. Ladies and gentlemen, your Rotarian of the Day, Joni Lombard.
Thanks.
Thank you so much, Doug, for asking the questions, and thank you, Joni, for sharing. I am actually going to turn it over to Kyle. He is our moderator for our program this morning. So Kyle, over to you.
Thanks, Marlis, and good morning, everybody, and welcome, and thank you for being here as well. This is a special program and a unique opportunity this morning that I hope you find the next hour or so to be informative and inspirational. A couple of housekeeping items that I want to touch on as we begin. The session is being recorded, so if you don't want your image potentially shown or anything like that, please turn off your camera. Also, please keep your microphone muted during the program. That way we can limit distractions and keep us on track. And if you have any questions for the panelists, why don't you go ahead and enter. Paul has been recognized as one of 6 Rotary People of Action Young Innovators at Rotary United Nations Day 2018, in the spring of 2017, of which Prior Lake was one of the host clubs. Graciana, glad you're here with us today. Yeah. Along with Paul and Graciana in the Eastern Hemisphere as Rahul Wadhwa, a member of the Rotary Club of Agra Taj Mahal in Agra, District 3110 in India. Rahul is the District Rotary Friendship Chair, District Foundation Coordinator, and Youth Exchange Chairperson. Professionally, Rahul owns a tour company and has helped coordinate a mega polio campaign in Agra that Rotarians from around the world participate in, including several members of the Prior Lake Rotary Club. In the Western Hemisphere, we'll start in England, and I'd like to introduce you to Siobhan Evans. Siobhan, originally from South Africa, was a youth exchange student hosted by the Prior Lake Rotary Club in 1992-93 and has stayed in contact with her host family and the club ever since. Now she lives in Rugby, England with her family and is the principal at Ashlawn School. Ashlawn is the largest secondary school in Warwickshire. I didn't get it right, shoot. Catering for students between the ages of 11 and 18 and is graded outstanding by Ofsted, the Government Office for Standards in Education. Siobhan is also a specialist leader in education and a challenge partner reviewer. Coming across the Atlantic, I'm not sure if Wilder is here yet this morning, but Wilder Benitez from the Rotary Club of Chimbote, Central Peru, is also one of our panelists, where he's been a member of that club for 6 years. Our club has a long relationship with Chimbote dating back over 30 years and has recently started doing more projects there again. Wilder has been a key contact on the ground and an interpreter for members of our club that are leading the effort to assist people in Chimbote, and we're glad to have him joining us today. Last, since the Prior Lake Club is putting this program on today, we thought it would only be proper to include one of our club members on the panel to get a perspective of what we are doing to deal with COVID-19 here locally as well. Please welcome our Community Service Committee co-chair, Mary Haugen. Mary is a retired educator and has been a member of our club since 2017, but has been around Rotary for more than 40 years. Now that we've met our panelists, I'd like to give a brief overview of our discussion. We're going to focus on two key questions. One, about how COVID-19 is impacting communities around the world, and second, being how people, especially Rotarians, are providing support. I've asked each panelist to keep their answers to around 2 minutes so we can hear from everyone. Once we're done with those key questions, depending on time and the amount of questions that we have coming in from everyone else, we'll add a little levity and hear some of our panelists' favorite memories related to Prior Lake Rotary as well. As I mentioned in the last part of our discussion, we'll open it up to questions from the audience, and please send me any questions you have at any time directly to me in the chat box, and I'll moderate that for efficiency's sake. If you do have a question specifically for one panelist, please include that in your question when you send it, and I'll make sure it's directed to them. With that, I'd like to start with our first question, and that would be, how has COVID-19 impacted your community over the past year, and how are things currently there? And I'll start in Uganda with Paul. Paul, go ahead.
Hi, thank you, everyone. It's nice to see you all. It's my pleasure as well to be part of this Rotary meeting. I'm from Nachivare Rotary Club, as Kyle said before. Let me go straight to COVID-19. Actually, it has done very bad. Let me focus on like 3 parts, like education, economically, and I would like as well to mention in the status of the refugee environment. Nachivare refugee settlement, Corona has done very bad because in terms of socially, there are no movements as well. There is no, in terms of socially, we are not moving, we are not traveling anywhere, expenses has risen. If we want to travel like from one place to another place, they have increased the transportation fee. Educational sector, students they stayed home, people cannot go to school, And some of our sisters, they have got unwanted pregnancies because they've been at home for a long time. So they have just got a time to stay home and have such an interactive with boys who don't have also what to do around. At the end of the day, they got pregnant. In terms of business, people, they have been limited. They are not supposed to work for a long time. In terms of education, in terms of health sector, people cannot access hospitals, health facilities because movements and people are hostilized to put on masks, face masks, so that they can be able to access health institutions. At the end of the day, they don't have the face masks. They just stay at home. And also a patient to go to the hospital, sometimes there is a long distance, so people cannot move and they cannot walk. And since the person is sick, cannot walk for a long distance. And people they are respecting like social distance. Motorcyclists, they have increased the prices where people have been using like to travel like 1,000 Ugandan shillings. They have made like 5,000, which is very hard to get that money. So there are a lot of challenges, especially in Nachibai refugee settlement. We have got also other challenges in terms of food. People, they don't have where to go and work since we always receive digital food from World Food Program, and people could go and walk around. So those movements of walking, they are limited. So people have been facing a lot of challenges because of this COVID-19. Thank you.
Thanks, Paul. We'll move on to Siobhan to hear how things are doing in England. Siobhan?
Thanks, Kyle, and thanks very much for inviting me to contribute. I think COVID-19 has really impacted on our community in really two very different ways. In the first way, there were lots of positives, really. I really resonated the reflection this morning, so thank you for that. Really resonated with me. You know, we really felt less division. We felt that we were all in together, all of it in together, both locally and further away. We knew exactly what our friends and family were doing abroad because, well, we were all at home. But, you know, the community came together. We supported each other. We were shopping for elderly people, those who were clinically extremely vulnerable, cooking for our neighbours who were isolating. As teachers, our ability to remotely educate had a very sharp learning curve. I think we all learned lots of IT in the first couple of months. As a school, we felt really privileged to be able to contribute the way that we did. We stayed open to children of essential workers and those who were vulnerable, those who are working with social services or had special educational needs. We carried on providing for them right throughout lockdown at the start and are fully open now. But of course, there were lots of negatives, and this will resonate with all of us, I'm sure. We have families in crisis, both well-being wise and economically. Huge rise in domestic abuse reporting, mental health concerns, safeguarding concerns for our children. And you know, that has continued really. We've had, since lockdown finished and schools reopened, we've had a sharp increase of all of those issues that we're dealing with in schools. So, you know, two positives: the community are still working really hard together, supporting those families who are disadvantaged, but there has been a lot of negative fallout for many of our more vulnerable members of society in our community.
Thanks, Siobhan. Rahul, how are things in Agra?
Hey, good evening from here and good morning there. Well, I can just see a lot of friends, you know, here on this meeting. So allow me to, you know, acknowledge them as well. So let me start with our dear friend Kate, and then Deborah, Paul, Jimmy, Carrie, and then Kyle. It was just so wonderful to receive that email and being a part of this meeting. So, well, friends, you have been knowing India has gone through 3 months of lockdown, total lockdown for 3 months. So the economy, everything has been really burned so hard that it will take some years to bring it back. But mostly, you can say, our schools are still closed. All the international trade and businesses are down by, 70%. So situations are not the real one, what we see as, on the media shows around the globe. So as part in Agra, well, life is moving, but you will be really amazed. People are not wearing any masks right now, and which is like a scary. We are getting, thousands of cases every day alone, in this northern part of India. So the situation back in whole India is not at all good. Hopefully, we should be good, in the coming months. Well, what else I can say is, if you talk only Agra, yes, Agra is mostly the hub of two major things: the tourism and the shoe trade. So I would say, tourism is dead, because we have no flights coming in and out from India. And the shoe trade is almost like working like 10% of frequency. So, yeah, situation, and maybe with God grace, we should improve in coming months. Yeah.
Thanks, Rahul. Yeah, tourism is obviously getting hammered everywhere, and I can imagine that that's the case with people not traveling to see the Taj Mahal right now. Wilder, are you here yet? I know they're having some internet issues in Chimbote, Peru this morning, but I'm not sure if Wilder's on.
Not yet.
Not yet. Okay. Graciana, how are things in Timor-Leste?
Yes, thank you very much for the invitation of welcoming me to this presentation. I will just share with you a little bit about how COVID-19 has impacted Timor-Leste, and because COVID-19 is globally. So in Timor-Leste, there were 22 cases in April, and we have like full lockdown for 3 months. And then now there is just like lockdown, but only for the international flight. And the government and the international organization are working very closely. And now we don't have any cases in Timor-Leste. The school is starting back as normal, but economically, the country is not really very good because many business closed down and many people also lost their jobs because normally in Timor-Leste so many foreigners are opening their business, but during this COVID their ambassador take back their people to their country, so many people has lost their jobs. And like normally in the local market, before COVID, they're able to sell a lot of vegetables, a lot of products. But during this COVID, they are not able to sell all those products. So economically, the country has like really gone down.
Thanks, Gracia. Last, we'll hear Mary from Prior Lake. How are things in our neck of the woods for the people that aren't in Minnesota?
Well, I would say that we'd echo some of the same things about the economics of the impact of COVID. Certainly, especially small businesses are suffering, and the entertainment industry, the restaurants, bars, theaters. Obviously, those things some people would consider, extras in life, but here they employ a lot of people. And consequently, that industry has been hit especially hard. And as it might seem counterintuitive, but also the healthcare industry, not just because those first line workers are feeling overwhelmed because of the COVID crisis, but we actually have clinics that have closed. We have staff shortages. We have people being laid off that work in certain medical areas that aren't being used right now because all the resources are going to COVID. So that's kind of counterintuitive. Our kids in Prior Lake are on a full distance learning, but we're fortunate that we have the technology we have and can give the kids the devices they need. So for the most part, our kids are able to be educated. Something else that's been a real difficult thing is that our nonprofits are struggling. So those agencies that have typically been helping the most vulnerable are having trouble keeping up with the demand. And also it's difficult for them to get volunteers, because oftentimes you might understand that retired people like me, would be out there volunteering. And now we're not doing that because we need to stay more isolated and we need to be more concerned about our own health. So there's struggling in many ways, money, contributed items, and then especially with volunteers. So those that were already vulnerable and marginalized are finding it even more difficult than they were prior to COVID. There's obviously limited face-to-face contact, but for those of you who are not from the United States, you probably know this, but I'll just reiterate it. We don't do lockdowns very well. We all have our own opinion about what we should or shouldn't be able to do. And we exercise that opinion. And as talk about what you're willing to do for the common good, or how strict your lockdown might be, or that it's been going on for 3 months. We have a lockdown, but it's quite dissimilar to what you've described. We certainly have things closed, but I don't think people look at it as the same as maybe some of you in your countries do. The other thing I would say is we know by statistics, like was mentioned by some of the rest of you, Siobhan, I know mentioned it, mental health, domestic abuse, unemployment certainly are all on the rise. And unfortunately, the minority communities are hit harder by COVID for a lot of reasons. And those, again, who are already marginalized are even in a worse way. So as affluent as you might think everybody in the United States is, or in Minnesota, we have homeless tent cities right now. And that's not just COVID. That's been going on for a long time, but you can imagine that those kinds of things are exacerbated by COVID. So that's kind of where we're at. From a Rotary Club perspective, we had to cancel our Music Fest, which is a huge fundraiser for us and allows us to have the funds to give to other people in need and groups in need. And without that, we have to kind of pivot. So that's what's going on here.
Thanks, Mary. We're going to come back to you because I don't believe I've seen Wilder yet. But our second question, and thanks for the few questions that are coming in. Again, if you do have any questions, please send them to me in the chat, and making a list of some very good questions that we'll be asking a little bit later. But now that we've heard about how COVID is impacting areas throughout the world, and with a lot of similarities there, I think it's good to also hear about the good things that are going on and how people are trying to help. And so the second question would be, what kinds of things are you as a panelist individually, professionally, or through Rotary with your fellow Rotarians doing to provide assistance to those community, or to those impacted by COVID-19 in your community? And Mary, we'll go back to you.
Thanks, Kyle. And I'm going to go pretty fast because there's been a lot going on here. So this is not a time for us to sit idly by and bemoan our situation. So Prior Lake Rotary right away last spring decided to focus on two things: safety and food insecurity. And our club tasked our community service committee with sort of organizing how we were going to do that and being leaders in this. And one of the other goals of our community service team was that we still needed to keep Rotarians engaged. We needed to find ways for people to feel like they had a purpose in solving some of the problems we had. So with food insecurity and safety, we also made a decision that we didn't need to start something brand new to duplicate what things were already going on with other longstanding service agencies. So the biggest thing they needed right away was cash. And we happened to have a club that had enough cash that wasn't going to be spent in our current year budget because of COVID. So we repurposed it and we gave $5,000 to the Y, to an organization called ROCK, which gets food into the hands of food insecure kids in our school district, to Southern Valley Alliance, that is an agency fighting domestic abuse, the CAP agency, which is the leading social service agency in our county to help people in need, and then to the school district to help provide financial assistance to people who needed childcare and weren't able to afford the cost of it. We also gave $2,000 to our Rotary district that organized a district-wide fundraising goal to give to food shelves in our area and to the Y. So we did a cash infusion right away. But we also created a volunteer opportunity list for Rotarians, and we encouraged Rotarians to add their names to it. For example, we had a Rotarian who said, I can fix just about anything. If you know of somebody in need, let me know. We had other Rotarians who said, we'll go get groceries for people who are not able to get out of their house. Just let us know. So we did that. We also helped distribute iPads to kids at the elementary schools when asked. We used our Music Fest fencing, and Rotarians went to the various restaurants in the community because they were only going to be allowed to have outdoor dining. And we used our fencing to create outdoor patios for them so that they could continue to be in business. We also found a way to still do hands-on things. We like to call them one and done activities. We packed 15,000 breakfasts through an organization called Harvest Pack and distributed them locally to social service agencies to get in the hands of food insecure people. We continue to do Strive, which is a mentoring program for our kids at our Alternative Learning Center. We managed to write and get approval for 2 district grants. And we also are now on December 12th, we're packing holiday food bags. We partnered with a local grocer and we're distributing those to 50 families in need. That's just a bit of what Prior Lake Rotary has been doing. We've also been continuing to be engaged with each other so we don't lose contact, and we have something to look forward every Friday, every Wednesday morning. So that's kind of a rundown real fast of what we've been doing to respond.
Thanks, Mary. Speaking of the Prior Lake Club too, many people may have seen in the chat here a few minutes ago a number of people talking about home runs, but that's not home runs. That's a member of ours, Homer Caston, who is joining us this morning from California. Homer spends part of the year in California, part of the year he summers in Prior Lake, and is a member of our club. And Homer will turn 95 years old on January 1st, and has been a Rotarian since the 60s. But we missed Homer this year because he didn't come back to Prior Lake for safety reasons. And so that's, if you saw all of the Homer that was in there earlier, that's what that was all about. And everybody, please join us in saying good morning to Homer, and thanks as always, Homer, for being here. And looking at the screen, and just so happens that my 2-year-old is on the screen as well. So we have a 95-year-old and a 2-year-old next to each other on the screen up in my windows there. Anyways, let's see who's next. Graciana, what are you doing, and what are your Rotary Club members doing to provide assistance to those impacted by COVID in Dili?
Yes, as you know, like Timor-Leste is quite small country, as what I shared just now, that economically it has gone down. So many people in the rural area, they are lack of food. It is also because of the COVID, and it is also because of the season. So what we are doing, we are providing the food. I think we have gone to around 16 villages in the rural area, and we provided more than for more than 1,000 people who are really cannot afford, those people who are old or widows or really coming from a very difficult background. So we provide them like a sack of rice with like 2 liters of oils, noodles with salt and all those things. But we only provided one time because we are lack of fund from Timor-Leste, and we got some funding from our district, and some of the fund is from the friend in Australia. They just contributed individually. And another thing that we are doing also, because like for the health department, the district supported with this kind of the thermometer, maybe around 50 thermometer. They bought it from Australia, and we donated it to the National Hospital.
Great. Thank you for your efforts. Siobhan, you're obviously an educator in England. How has that become challenging from your end of things to help provide assistance to kids that are being affected in many different ways because of COVID? And what else are you seeing the community do to try to make a difference?
So schools really became the centre of provision across the country. We are uniquely placed to be able to identify those who are most vulnerable, as opposed to falling through the cracks. We were also able to visit our targeted students right through lockdown. We continue to do that now. Social services had to work from home, so it was schools and teachers going out really. We picked up those problems. I'll give you examples. We found out people that didn't have enough food, clothing, and so we provided that with the help of our community. We put out requests, and the community really supported us. We've got a great local community of parents and families. We delivered food, clothing, sanitary wear for girls, furniture, bedding, toiletries, you name it, for all of those families that we identified. This continued right through summer and has continued now. For example, some of our staff every Sunday we're going to supermarkets getting, there's a program you can tap into where our supermarkets give us food that is in date, that they're going to take it off the shelves, and we were able to deliver it the next day. Recently, because food poverty is still very much a concern for us, we have, obviously in England, schools are uniform, we all wear uniforms, so we have non-uniform days. And in return for that, our students come in with food for the food bank. An example, just the other day, in one day, we collected £2,500 of food for our food bank, which is, being really stretched this year. We are donating as staff this year. We've decided we're not doing Secret Santa gifts for each other. We have a group of about 100 or so students that we are going to be doing Secret Santa for from the staff. And quite honestly, I think I've never seen staff more excited. I don't think we'll ever go back to buying each other presents. Really the big thing though for all of us in schools across England and no doubt across the world is what we call our recovery curriculum. Our students have been affected with mental health issues. Even those that were working really hard through their remote education have had sort of deficit learning opportunities, and I think that's possibly as I said, everybody. And we've certainly noticed a huge gap between our what we call advantaged and disadvantaged students. We've worked so hard to try and close that gap, and we've unfortunately noticed that it's gone really wide again. And so we have our schools are fully open, attendance is mandatory, and we're working so hard with those students to be able to close the gap. And I think that's that's our mantra: education is freedom. If we can ensure that our students get back on track, that will be the best contribution we can make to our country.
Thanks, Siobhan. Rahul, what are you and the Agra Taj Mahal Rotarians and the other Rotary clubs in Agra and around India doing to help with the situation? There you go.
Well, we have like 12 clubs in Agra, and we really came forward all together, coordinating, and made so much of supplies during this COVID time, and especially in this lockdown of 3 months. So, well, you won't believe, but we really distributed like 80,000 food packets to our frontline warriors, like cops, working round the clock on the streets. Then the doctors and the staff in the government clinics. And plus, we distributed those packets to the poor people back on the street because everything was closed. They have no resources to have food from any way. So that was really interesting for all of us and made us proud in terms of Rotary. Plus, I do have a few things to, we distributed like around 47,000 masks, in Agra itself. And we distributed like, 718 oxygen cylinders in the government clinics. Then we, distributed almost 680 sanitary pads to the girls in the rural area. And then, we distributed like 2,000 of liters of sanitizers at different places. Plus, I am very happy to, acknowledge my friend here who is in the Zoom and, Rotarian John Kaufman from California. So through him 2 years back, we got, a water purifying, system. It's a complete condensed plant in the name of, H2 Open Doors. So through that, we really serve the community in distributing somewhere like 3,820-liter water bottles in our community. So that was again a good, brand, you can say good working with Rotarians locally. And again, we were so proud that, that we can really deliver this good quality of water to the local community here. And of course, still the work is on. We have not, closed things. So a long way to go still.
Thanks, Raul. I want to ask Paul to speak, and this may be, at least from the perception of most of us. I mean, when we think about a refugee settlement or camp anyway, and what we think of that as, Paul, tell us what the Naka Valley Rotaractors, a group of refugees, are doing to help make the lives of other people in that settlement better. Paul?
Thank you, Kyle, once again for the floor. My Rotract Club and my fellow Rotractors, from the first day they have put the lockdown, we have tried to do a lot of things to show the people that we are real or true Rotractors. My club, it's good enough that Kyle has visited in Aki Valley before. We have different youths with different talents. Some of them, they started to compose music, sensitizing people in the community that really there is this virus around. Because people here, some of them, they didn't believe that COVID-19 exists. So through the music, people, they try to compose music that there is this disease, so you have to follow the guidelines. Apart from now sensitizing the community, my club now, even today, I think we had another project of we continue teaching people in the community how to make liquid soaps, so that people in the villages can be able to wash hands. Yes, our community and their beliefs and like washing hands every time is not like our culture, but we have now come up with that system of we go to the community, different communities. Our settlement is too big. It is almost 71 square miles. So we formed another Rotract club inside the same refugee settlement so that we can be able to reach different parts of the settlement. So we have tried now to train different people how to make liquid soaps. I'm very grateful for Rotary that they are Rotarians outside the camp. They have brought materials, they deliver them to the settlement. Now it is our role to go and teach everyone in the community. And for those people who have been affected, have been taken to isolation centers. So my club took that responsibility to go and take cartons of soaps. We have taken more than 60 cartons to the isolation centers so people can be able to wash their hands. And we have also created face masks with Rotary logos. Everybody here in the camp are very excited whenever they see Rotary logos around people. They are wearing masks with Rotary so that they can be. Now it has opened an opportunity for those people who have been prevented to go to, if you want to access any service from public offices, you are supposed to put on a face mask. So there are people who don't have money to go and buy face masks. So we have distributed face masks to every refugee so that they can be able to go and access services to the different offices here, like different NGOs who are responsible for refugees. And also my club announced to different NGOs that operate here in the camp that in case they need any support, like for youth, we are very energetic in case you need our support in terms of like you want to distribute something to the community. We are well trained. So anytime you want our service, please call us. So we did a joint project with currently is called Allied, before was American Refugee Committee, with Office of the Prime Minister of Uganda and the other NGOs. They came up to us and they asked our support that we need Rotaract youth to come and help us to distribute these items that have come to support their fellow refugees. So I'm glad that my club is doing well. We are doing different activities so that we can see how we can minimize these COVID cases. Last week, last 2 weeks, we were again put in lockdown because there are some new cases were rising around the camp. So they broke now movements again. So there is that attention that there are some new cases. So people now are not freely moving like from outside the camp, going to the camp. So there are those limitations. My club now is trying to, again, to sensitize the community that they should not move around to maybe to go to Kampala cities, because where now people, they are in elections, where people are now, they are doing rallies, where they are massive, they create crowds, and those infected people, they can meet with some refugees and they come back to the camp again, then they spread that disease. So that is the role of our Rotaract Club, to make sure that they keep that disease and control it. Thank you very much, guys.
Thanks, Paul. Thank you, and thanks for everything that all of you are doing in your communities to help prevent further issues with COVID. I want to go to a couple questions that we've gotten so far, and I'm going to combine about 4 of them as we talk about. Let's talk about vaccines. Certainly, with the news yesterday that the people in the United Kingdom began to first get the vaccine yesterday, along with now it's starting to be rolled out in other countries. I guess to the panelists, what have you heard about the availability or timeline of the vaccine in your country? And Siobhan, maybe talk a little bit as well. In fact, we'll start with you. What is the reaction to people in the UK as the vaccine has started, and are people eager to get that vaccine?
Yes, so we're really proud. That actually took place about 15 minutes up the road from my school. To be first in the world to have the vaccine is incredible. The time scale is really age dependent and vulnerability dependent. So we're starting off with older people and then those who work in care homes, because that for us has been a real hotspot for infections, tragically so in many cases. And then we're going to go down the age groups. So in terms of timescales, I think it's due to get to the 50 age group in about the spring. I'm not quite sure what happens after that. So my age group, for example, is not quite listed yet, and educators and nurses and that aren't yet on the vaccination list. So that's as far as I know. But we're really excited. I know some people are quite skeptical about vaccinations in general, and that's something we're trying to overcome. I suppose real news versus fake news and science versus opinion, and that will be a challenge for all of us, I'm sure. But yeah, very exciting to be sort of in the epicenter of the world in terms of hopefully turning the corner. Towards the end of all of this, we can now see a bit of hope, and I think that's what it's given us, is hope.
Thank you, Siobhan. Rahul, how are, regarding the vaccine, what have you heard about the availability in India? When do you think that may be? How do people feel about that? Go for it.
Yeah, thank you, Kyle. Well, we hope the medicine should be, in real circulation by February end. And we don't have such a plan that who will be like on the first priority, but we are sure that our frontline workers will get them on the first time. So we are still waiting on the plan from the government.
Okay. Okay, so it's still up in the air as to what's going to happen there. Paul, how about in Uganda or in Nakavale specifically? What have you heard anything about when you may begin to receive vaccine and how that'll be done?
I think we have not yet received anything related to vaccine, but people here are using their local mechanism, like they bring to, like they get lemon, they get ginger, they get like lemon, ginger, and hot water. They boil it together, they spiced it into, then they have now mobilized the whole community that when you use this one, at least sometimes it helps, but nothing related to vaccine we have had, or maybe there is that plan that they are going to bring it. But for myself, last month is when I had a communication when they were, the Speaker of Parliament, when she was talking about the vaccine that they have had. There is some people in the USA, they have made a vaccine and they are planning now how they can introduce it to Uganda.
Okay, thanks, Paul. Graciana, it sounds like obviously the government in Timor-Leste and the people have done a pretty good job on limiting coronavirus cases at this point. What have you heard with regards to any updates on the vaccine?
Yes, in Timor-Leste, the government, they are working very closely with the WHO, and anything this WHO always supports. And about the vaccine, what we hear is like the Chinese, if anything really happen, the Chinese will support, but so far the cases is not really serious. So like comes and then it goes, comes and it goes, because the government and WHO are working very strongly to prevent this COVID.
Okay. Thanks, Graciana. I want to, Graciana, since you're on, and I want to, there's another question. Rod Ammerman from the Prior Lake Club asked you specifically, has the school stayed open? And if so, what impact has COVID had on the education of the students?
Yeah, for the 3 months full emergency state, most of the students went back home. But I think in July they started open again. They only closed the border for the international flight, and many students also drop out because some people, they couldn't afford to pay for their food fee because of this economic drop down. But now there's the number of students are not the same as before. Before, like, we have around 500 boarding students. Now we only have 200, 180. The number has dropped because of they are not able to afford to pay for their food fee.
Okay. Okay. Thanks for sharing. Rahul, a couple questions your way here. You mentioned that there seems to be a divide between people wearing masks and not wearing masks, or there's certainly a lot of people that aren't wearing them. Is there is this some sort of political statement, or is it people not believing there's a virus going on? And how significant is that division between mask wearers and non-mask wearers?
Thank you, Kyle. Well, there's nothing like anything politically, or no one is really forcing them, or no one is trying to, tell them, okay, you have to wear the mask. But the reality is they don't believe, especially in rural. India is more rural than urban. So they don't believe there's any virus called, corona, and they don't believe in COVID-19. Just the borders were open after 3 months of lockdown. They were like on the street. And we are all having, hard time to convince them. And you won't believe, but every, corners, every city of the, on every state is imposing. They made a law recently that everyone who has to be in the car on the road has to wear a mask. So that is a nice and better idea, but still the public is not wearing masks.
Okay, thanks, Rahul. Speaking of potential conflict, Paul, a question from someone in the audience, Jerry Wursel from our Prior Lake Club, and in fact, Paul and I were texting about this last night, but he'd heard of recent election problems, revolts and violence in Uganda. Is this true, and how has that impacted the COVID-19 dilemma?
Yeah, well, I think because of that scandal that happened, there was no control. A lot of youth been striking around, and it has spread. It has spread more cases concerning COVID-19 because there was no control. People created a lot of crowd, so it was not easy to control them, like either following the COVID-19 guidelines.
Okay, thanks, Paul. A couple of questions that are kind of similar. Number one, what is one thing? No, that's not it. What are your governments and your countries doing to financially support the residents there? And and this one was directed towards Siobhan, but I guess it could be everybody. And I follow up in kind of a addition to that. Do big corporations allow workers to work from home, or do people that have the ability to potentially work remotely do they still have to go into work? Siobhan, why don't we let you tackle that two-parter? So the first part, what's the country doing to financially support residents, if anything, and is there ability to work from home?
Okay, so at the start, it was announced very early on that we have a system called furlough. So companies that could not afford to retain their staff because they'd had to close or whatever, the system was that individuals would get up to 80% of their salary to stay home, up to a total of £2,500 a month. So that was helpful for many, and they were able to stay home and self-isolate. That system is continuing until March, although it has started to be reduced. So companies now have to pay a percentage of that furlough, but it certainly has been the difference between being able to eat and not for many people. We are currently in tier 3, which means our area is in high risk, and most of the country is considered to be in tier 3. And so all big companies are compelled, not only at the beginning during the true lockdown, but even now are encouraged to ensure that staff can work from home wherever possible. It tends to be, I suppose, more white-collar roles and jobs, and so those who cannot work from home can work at work. But we have many thousands of words of government guidelines and what we do in order to help us to be what they call COVID safe. So I'd say in summary, our government are doing quite a lot. And certainly at the beginning, they were very decisive, and I think we felt we were really secure and well led. It has become harder and harder, I think, to keep everybody together. The downside, of course, is furlough is great if you are employed, but we have had masses and masses of redundancies. We've had whole retail chains that genuinely you would never have thought they'd go under are just closing. I've never seen anything like it. I have so many people that I know that have been made redundant, and of course, when that happens, you don't get furlough money.
Thanks, Siobhan. Rahul, anything to add in India on that part?
No, I think it's good. Yeah.
Okay. Does anybody else want to answer? Paul, Graciana, Mary, anybody have anything they'd like to chime in with on that one?
Just, I'm going to translate for Siobhan. Redundancy means you got laid off.
Okay, sorry.
That's okay. I just had to give you one for the day.
Got it. Mary may have been Siobhan's host mom when she was here 27 years ago. I want to go, not a question of one of our panelists, but somebody else that's on the call this morning. Dr. Abul Shara is a Bloomington, Minnesota Rotarian, and a number of years ago founded International Village Clinic in, I believe, Uttar Pradesh, India, not where Rahul is, but in a different part of kind of the northern part of India, and has turned that clinic into a significant health benefit in that area. And a number of Rotary clubs throughout Minneapolis area support International Village Clinic each year, including the Prior Lake Club. Abul, how is your clinic doing during this COVID time? And if you could just touch on that briefly, how things are in that part of India. You're still muted there.
Here we go.
There you go.
Thank you very much, Kyle, for the opportunity, and thank you for inviting me. This is a great gathering. I haven't heard so many people from all over the world in a long, long time. Talking about our situation in India, I'm happy to share with you that our clinic is going very well. We have 60 people employed, as you know. Not one has been infected yet, and part of it, credit I'll take, but most of it may be luck. I returned from India after my 6 months visit last March when Corona had just started. And I read all the CDC guidelines, not for myself, because I can see the internet, watch TV here, but for our people. Got it condensed in a couple of pages, got it translated in Hindi, and we distributed it to all our employees and very, very strictly followed the CDC guidelines, the golden rules, which is, social distancing, masking, got masks, made 2 masks for everyone at our employees that they can wash and change every day. We have temperature readers so we can screen everyone who comes in and goes out, and really it has worked. The unfortunate part is the school. As Rahul pointed out, schools are totally locked down. And I had a question for Rahul when he gets a chance to answer. What's the news there? When are the schools going to open, especially nursery to kindergarten class 1? So thanks again, Kyle, for the invitation. Things are going as well as you can imagine back in India.
Thanks, Abul. And thank you for all that you do. Rahul, do you want to answer that question?
Yeah, sure. Good to see you. Well, we hope so. There's nothing officially date announced, but it should be next session. Let's say somewhere around maybe April end or early May. That's a presumption we can do right now.
Thank you, Rahul. That's a sad situation because the kids and parents are, as you probably know in your area too, everywhere. They are very, very sad. They are losing a whole year.
Okay. Thanks. We have time for another question or two right now, and this one's a challenging one that I'm not sure what the answer to is, but I'm going to see if Emily Tucker, our regional membership officer from Rotary International, who's on today, can maybe at least give a brief and broad answer on this, but talking about what kind of a role Rotary or Rotarians can play in helping vaccination, education, and implementation efforts throughout the world. Emily, have you heard anything from inside of Rotary International headquarters as to what kind of overarching role that may be played there because of our efforts with polio and so forth?
Hi, Kyle, and hi, everyone. Thanks for the question. And sorry I have my camera off. I'm just sort of multitasking with my 9-month-old baby this morning. I am on staff at Rotary International as a regional membership officer. So thanks, Kyle, for the invite today. I wish I had a better answer to this question, but we haven't really heard about any sort of international effort in terms of vaccination. We on staff have, been getting frequent updates on the COVID situation from our general secretary. And we as staff members of Rotary International, of course, have been asked to, be examples, be good examples in our families and in our communities, since obviously one of the main tenets of our organization is disease prevention and eradication. But I haven't really heard about vaccination efforts, but I would be happy to check in with some colleagues, particularly who work in the foundation, and I'd be happy to follow up with the club on that.
Thanks, Emily. Yeah, maybe we can get that maybe we can get that information out. You know, as we start to wrap up here, number one, please join me in thanking all of our panelists for being here and sharing the perspectives around the world today. So I'll pause at least for that virtual clap for 5 seconds or so. You know, and what we've seen is a world that is obviously struggling together, but working hard to make the lives of themselves and people around them better as well. And and there's all sorts of things that any of us can do as Rotarians or otherwise. And I think we can all do something. And I'd like to, for a last little bit of inspiration, which I think we've all gotten some today, I'd like to see if my son Cooper would like to say what he has done. Not my idea. This was he and his mommy's idea. Oh, no, I don't know. Okay, he doesn't want to this morning. That's okay. But he came up with the idea to take the books out of the little free library in the front yard and get food for people in the ask for people in the neighborhood to get food to give to the food shelf for people. So any of us can do something to help. And that's, I think, where we'll leave it. And certainly Rotary is positioned in a great way to do as much as possible. So again, thank you all for being here. And I'm going to turn it over to President Marlis for a couple things as we end the meeting. Marlis?
Awesome. Thank you, Kyle. I also want to say a special thank you to all our panel participants. It was great to hear from around the world. I want to thank Mary Haugen, Graciana, Siobhan, Rahul, and Paul for being with us today. As a part of our speakers, we do make a small donation to our CAP agency, so we will be making a donation to CAP in your honor. With that, I also want to say a special thank you to Kyle. Kyle, thank you for putting this all together. It has been very inspirational, and it's been great to hear from all of those around the world. And with that, I am going to turn it over to Ed to make an announcement from the district.
Everyone from District 5960, and just want to let everyone know that we have a Friday feature program about every 2 weeks, and next week on the 18th we're going to have one of my club mates, Dr. Tracy Sides, who's an epidemiologist and has a PhD in environmental health. We'll be talking on COVID-19 and the path forward here in Minnesota. It should be a very interesting program. Invite you all to tune in, and you can get register for it on our district website, District 5960. Thank you, Marlis.
Thank you, Ed. Appreciate it. As a send-off that we do for our Prior Lake Rotary Club is we always end our meeting with the 4-way test. I think it's good inspiration for us to send everybody off with that. And with that, I am going to turn it over to Joni Lompart to lead us in that.
In all the things we think, say, and do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Thanks.
Awesome. Thank you, Joni. And I want to also say a special thank you to those that helped also put together this meeting for us today. Thank you so much to Paul for doing some of the promotional things on this. Kathy Hewitt and Darcy Rose, our administrative support people helping behind the scenes. Also those that are helping us out with our Zoom, Joe Doles and Dave Card, thank you for helping out with that. I also want to thank everyone for joining us today, our Prior Lake Rotarians and our friends from around the world and our Rotarian friends from around the district. So thank you for joining us. If you have any more, want to check out Prior Lake Rotary, our website is priorlakerotary.org. Feel free to do that. But with that, have a great rest of your week. Have happy holidays and thank you. Have a good day.